A very good afternoon to one and all present here. Today I'd like to present my topic on unraveling the genetic puzzle, genotype-phenotype association in aniridia. Aniridia is a congenital partial or complete absence of the iris. It is a rare panocular disorder affecting cornea, anterior chamber, iris, lens, retina, macula, and optic nerve. The prevalence is up to 1:1 lakh in the population. It is resulting due to an insult during the 12th to 14th week of intrauterine life. Mutation in the PAX gene, short arm of chromosome 11, is noted. The aim of the study was to check if there was any phenotypic association of aniridia. Methodology, ethics committee approval with detailed consent was obtained. Prospective study, all subjects with aniridia and family members with the similar phenotype were tested. Detailed history, examination, intraocular pressure evaluation was done. Genetic analysis was done. First and foremost, of course, a written informed consent, which was detailed in nature. Exome study was done, wherein a single gene mutation was identified. The mutation was confirmed by single genome study in affected family. The whole genome sequencing was done. Novel PAX6 gene mutations in all the 11 patients, autosomal dominant inheritance. Autosomal dominant inheritance, we should note, does not have any systemic associations. It is the most common presentation. About up to 85% of patients found to have aniridia have autosomal dominant inheritance. Out of the 11 patients, 6 were females and 5 were males. Likely pathogenic gene was found in 6 patients. Pathogenic association was seen in 3 patients, and 2 patients had mutations of uncertain significance. Only 1 patient did not have familial history of congenital aniridia. 2 patients showed mutation in 2 other genes, along with PAX6 gene, FBN1 gene, which is found to have association with Weil-Merchandisani syndrome, and CRY-GC gene associated with multiple types of cataract. This is the pedigree chart of the first family. As you can see, the mother there was no in the first and second generation there was no affection. The mother and her 2 children had aniridia. Case A, which is the mother, she had congenital aniridia with glaucoma, nystagmus, limbal stem cell deficiency, and bilateral corneal opacity. Both, we can see that she had only PAX6 gene mutation. Case B, her son, also had only PAX6 gene mutation with aniridia, micronystagmus, flat cornea, and fundus examination showed foveal hypoplasia. Case C, her daughter, found to have partial congenital aniridia, cornea plana, nystagmus, and LSCD. She also had only PAX6C mutation. Second family, wherein 2 sisters were noted to have aniridia along with their father. Case D presented with clinical indications of congenital aniridia with nystagmus, pseudophakia, severe foveal hypoplasia. Her father could not be he could not come to the OP because he was abroad. Her sibling was also similarly affected. PAX6 gene was found to be affected in both. The third family, wherein the father and the son and daughter were affected. The father, case F, was born of non-consanguineous marriage. Clinical indications of nystagmus, cloudy cornea, and glaucoma since 2 years of age. PAX6 gene again. And the son, case G, was found to have CRY-GC, and of course congenital bilateral cataract along with glaucoma and nystagmus and aniridia, along with a history of leukemia, which was subsequently treated. His sister had aniridia, ptosis, nystagmus, and bilateral cataract, but she had only PAX6 gene mutation. The fourth family showed the father and son were both affected. His son, the father had PAX6 gene mutation, and the son had PAX6 with FBN1 gene mutation. But no features of elasticity were noted in this patient. He also had glaucoma, bilateral cataract, and congenital aniridia. The fifth family we could see that this was a unique case where there was no family history of aniridia. She had nystagmus, foveal hyperplasia, and strabismus, and only PAX6 gene was noted to be affected.
Will you conclude?
Molecular genetic revelations can pave way for better identification, and we observed intrafamilial variability of phenotype, and our study supposes the hypothesis that a mutation in PAX6 gene correlates with the expression of aniridia. It did not reveal any evidence of sporadic inheritance, and no evidence of those who are affected with FBN1 gene and CRY-GC did not show any new associations that could be thought about.
Thank you.
Thank you.
Sorry, can you hear me? Yeah, thank you. So this is interesting. Most of your cases were familial. Okay.
Yes, ma'am. Yes,
so most of them had features of aniridia in the child.
Yes, ma'am.
What was the genetic test? Did you do a whole exome or a chromosomal microarray?
Ma'am, we did a whole exome sequence.
So in that case, when there is a familial aniridia and phenotypically you are seeing aniridia, a chromosomal microarray would be the study of choice in this case, okay? If this is something sporadic, then you have to look for things like Vagor.
Exactly.
You have to do an ultrasound. Then
Yes,
maybe you can think of a whole exome. But
Yes,
when you already have a familial,
Yes,
then chromosomal microarray should have been the... So you don't get all these 1,000 variants of uncertain significance, and then you don't know what to do with them, and then you can't phenotypically correlate what you're seeing genetically, isn't
Yes,
it?
ma'am. Yes, ma'am. That is, I'll note that next time.
In which city this study was conducted? In which city this?
Kozhikode, so Calicut, in Kerala.
Kerala.
Yes, sir.
And what is there any history of consanguineous marriages on that?
No, none of them, all of them were born of non-consanguineous marriage, sir.
Okay, fine. Did you take in the study?
Yes, sir. Yes, sir.
And what is the main aim? Because you are not.
Basically, sir, we wanted to see if we could.
No, for the society, what in final for what conclusion you give to or advice give to the family? What?
Sir,
Something.
basically genetic counseling, which we already know about, but we were wondering if, there are various presentations of aniridia. So we were wondering if we could, through a whole exome sequencing, which was only available at that time.
Okay, so
Microarray was not available
for
at
the
that time.
literature.
Yes, sir.
Dr. Himanshu, next.